Since the senior population has increased 40% in our community in the last 10 years, we thought it was important that we come to the Briargate Senior Medical Center. And with me is Dr. Harry White. Thank you for being here, Doctor.
Thank you for inviting me.
Well, what is the mission of the center here?
Well, this was really opened up by Kaiser Permanente to serve the special needs of older adults in our community. That the focus is on providing holistic care, including addressing physical needs, emotional needs, functional needs, psychosocial needs, and really try to provide a single setting where somebody can come in and get a kind of comprehensive overview of what their medical issues might be, what their questions about wellness and prevention and preventing disability.
Very good, very good. So does a person have to be a Kaiser member to come to this facility?
Yeah, well, when we initially opened up, we were focused on Kaiser members who had Medicare Advantage.
Mm-hmm.
Since that time, we've now opened up to Kaiser members who are 55 and older.
Okay. Well, that's good. Are there any, you can come and have your hearing tested here, right, and not be a member of Kaiser? It's my understanding that you could do that. So there are some things you could do here without being a member, but basically you have to be a member.
Mm-hmm.
So basically, what are the patients like who come here? Are most of them very ill, or is it mostly preventive, or both?
It's both. The interesting thing about as the population grows older is that patients above 65 are really a quite diverse group. I mean, you have people who are kind of the young old, who are from 65 to 75, who really have just the normal issues of kind of that they may have had since their 40s of high blood pressure, high cholesterol, arthritis. And I think in Colorado Springs, this is a very active community, so we see lots of older people who are bicycling and hiking and skiing, and are really kind of focused on what they can do to prevent disability. And then we also see older patients in their 90s who have kind of a different set of issues. Some of them may still be quite active, but other ones have what we call geriatric syndromes of issues that don't necessarily represent one disease, but maybe a combination of several different factors. So for example, we may be seeing people who are experiencing problems with their memory or problems with their balance and are concerned about falls, or people with urinary incontinence. And we need to kind of sort out sort of what medical factors and social factors might be contributing to it, because sometimes rather than being a single illness, it really represents a combination of an illness, medications, social problems that are all contributing to creating a level of functional impairment.
So this is a place where it truly is a holistic treatment for the patient. So it's a place where people who are 55 and older can come.
Yes.
All right. And with the way that the world is going and we're all living longer, this is really important to our community. So thank you, Dr. White.
And actually, this is the first Kaiser Permanente clinic in the whole country that was open specifically to deal with problems of seniors.
Oh, really?
So Colorado Springs is kind of a test ground for Kaiser Permanente in the other parts of the country.
Very interesting. Well, we're fortunate to have the center here. Thank you.
Thank you.